Second Sight presents an introduction to the Argus II Retinal Prosthesis System, enriching the lives of the blind, and the only FDA-approved treatment for people with end-stage retinitis pigmentosa. In this presentation, we will be covering the following topics: the history of the Argus II and the history of Second Sight, an overview of the Argus II Retinal Prosthesis System, what the Argus II provides, the treatment pathway, costs, and future developments. Before we discuss the Argus II, it's important to know how the Argus II came to be. In 1998, four prolific entrepreneurs, Alfred Mann, Sam Williams, Gunnar Bjorg, and Aaron Mendelsohn, met with a goal of creating a retinal prosthesis to provide sight to people blinded from outer retinal degenerations such as retinitis pigmentosa. From this initial meeting, Second Sight Medical Products was born. Sam Williams was the primary driver of this effort, having been diagnosed with RP himself. Back in the 1980s, Sam agreed to fund research conducted by Dr. Eugene Dewan Jr., a retinal surgeon at Duke University who hypothesized that some level of vision could be restored to people blinded by RP. Sadly, Sam never had the opportunity to be implanted with the Argus II, having passed before commercialization of the device, but his legacy will live on as utilization of the Argus II expands. In 1991, Dr. Dewan Jr., along with Dr. Robert Greenberg, Dr. Mark Humayun, and Dr. Jalan Danieli performed the first early experiments with a subject, Harold Churchy, completely blinded by retinitis pigmentosa. A thin wire, less than the width of a human hair, was inserted into his eye, and a small electrical current was applied. When Mr. Churchy said that he could see a spot of light, another wire was inserted, and another small current was applied. When he said he saw two different points of light, the researchers knew that electrical stimulation of the retina could elicit visual percepts, and thus demonstrated that the concept of a retinal prosthesis was viable. Here is a brief timeline of the Argus II, beginning in 1991 with the first research at Johns Hopkins University. In 1998, Second Sight Medical Products was founded. In 2002, the Argus I trial begins, followed by the start of the Argus II trial in 2007. 2011 marked European approval and the first commercial implants in Europe, and in 2013, FDA approval was granted. In January of 2014, the first U.S. commercial implant of the Argus II was performed. This chart shows the rapidly expanding rate of Argus II implants. Today, over 300 people worldwide have received the Argus II. For those of you not familiar with retinitis pigmentosa, RP is a progressive, inherited disease that can lead to total blindness. It is typically diagnosed during childhood when patients begin to notice problems with their vision. It generally begins with difficulty discerning colors or seeing at night, and progresses to loss of peripheral vision leading to tunnel vision, and oftentimes results in total blindness in later years. While RP may advance differently and at different rates from person to person, the prognosis is the same. There is no cure and no way to stop the progression. RP impacts nearly 100,000 Americans with an incidence of 1 in 3,000, and is often associated with a decrease in physical mobility, an increase in the number of accidents and injuries, depression, and anxiety. Until the FDA approved the Argus II as a humanitarian use device, there was no FDA-approved treatment option for RP patients with severe to profound vision loss. The Argus II is FDA-approved and commercially available. It is a proven technology and not experimental. Now let's hear from some of our current users, in their own words, what the Argus II has meant to them.
I am really, really so grateful that Wool's Eye is available to do this extraordinary, exciting procedure.
And there's something here with
The computer.
Yep.
See?
That is awesome.
Oh, Eric, I can't tell you, honey. I cried. You cried?
I'm so happy.
So it's the
We're going
top-
to take the curtain off, and then it's going to get brighter.
Okay.
Ready?
Yeah.
Now, should I lift the blinds?
Sure.
Yeah, lift the blinds.
Eric, my heart hurts. Wow. I look left to right. I see what's is at the edge over there.
That's
Yep.
it. You
Oh
got it.
my God.
That's awesome.
Julie.
Yep. Bingo.
Oh. And the top is there.
Uh-huh.
Oh my God.
You can
No.
put hide and go
And
seek with
guess
your
what,
grandchildren.
Eric? Wait, Eric.
Yeah.
I have my eyes closed, and I can see everything.
I
I see Libba looking right at me.
didn't even think about that. Oh, that's so creepy.
Not running into walls and not getting so frustrated.
He's less frustrated. And it sounds so little, but to be able to have a plate of food in front of you and your cup. I know my cup is here, so I can eat my food and not knock my cup on the floor. That sounds so small to people, but to us that is huge. To be able to locate your food on the table and to be able to manage that, to be able to walk through that door without slamming into the wall. Those things are huge for us. And we've gained that back. We've gained that back.
A lot.
We don't know where it's going to end. I say it's a life changer. We don't know where it's going to end.
Everyone who can have it, I want them all to get the system. Because I know for me it's so important. I think it's important for other people with retinitis pigmentosa to have it. Yeah, that's my goal. Yeah.
Encouraged by his instructor, Haroon holds the bow and aims, repeatedly firing arrows at the archery target.
I'm going to restaurants and going out and yes, going socialize. Yeah. In September I was on the beach and it was 3 weeks of fun. That's very emotional. When I'm in a bar and I see the lights and the contours of the people, that's very exciting for me. And so I made the choice to do it because I've seen it in the archery that it works. It's the quality of life, I think it is. Got no regrets because it's so successful.
Haroon laughs as he celebrates hitting the target.
Claire, what can you see right now? Nothing now. Nothing now. Everybody ready? Okay. So 3, 2, 1, start stimulation. Yes.
Can you see?
Oh my goodness. Wow,
Can
what
you
do
see,
you
Larry?
Yes.
Oh my goodness. Can I give him a kiss?
Yeah.
Oh, yes.
Wow.
Can you really see?
Yes.
Oh
It's
my
flashing.
goodness.
Big time flashing.
It was incredible. It was bright and it was significant. And I just had to take a deep breath and I was just, it was hard to articulate what I was feeling, but I wanted to share it with everybody I could grab at the time and hug.
Thank you for this opportunity for Larry to see a little bit again.
Right there.
Yeah. Oh, look, he did it. He went right to it. Woohoo! All right.
That's pretty cool.
Way to
huh?
go, Larry.
Wow.
I mean, Yay.
that's significant right there. Wow, that's cool. That's great. That's amazing. Huh.
Isn't that wonderful?
That is
It's only going to get better. You know
that.
it?
Hold on, I got to do that.
2 weeks later,
On pins and needles. Or on electrodes, I should say.
comes a moment Alan thought he'd never see again.
I don't know if I'm really prepared.
His children and grandchildren are already moved by possibility before the bionic eye is even turned on.
There.
It takes a moment for his miracle to come into focus.
Oh my goodness.
I picked you up. Oh. You picked me up. God bless you. It's crude, but it's significant. You know, it'll work.
And perhaps most meaningful,
It's something we'll remember for a long time.
to his grandson, Caleb.
I knew that I was a carrier, and we always knew if we had a son, he would have a 50-50 chance. And we had always hoped that he wouldn't be that 50. But
Caleb now has greater hope for his inherited disease.
He can succeed, and that he's defined not by his limitations, but by his abilities that God has given him. So I hope he appreciates that.
So for his grandson, Alan steps into the unseen.
Oh, yes.
You just saw your first sunshine.
Oh,
okay?
No, that was her.
That's true. Your reflection is there. So it's almost like we're looking into a mirror.
Yeah.
It's now clear. Vision,
I know there's something in there.
is much more than modern technology.
It's very narrow.
That's right.
wow.
Through Alan's eyes, it's best described as state of the heart.
Oh, I can see with my eyes closed.
So let me explain how the Argus II works. The Argus II system consists of an implantable device and an external computer called a Video Processing Unit, or VPU, and a pair of glasses with an integrated camera. The camera captures a scene that is processed by the VPU and sent to the implanted device, which the brain learns to interpret as vision. The implant consists of an electronics package that is attached to the outside of the actual globe of the eye, but under the skin of the eye so it's not visible from the outside. A small 6x10 electrode array is then inserted through a small incision into the eye and attached to the macula at the back of the eye. This array acts very much like an old-time baseball scoreboard, where if you light up certain dots or pixels in a particular pattern, you can form shapes, lines, and other objects that your brain can learn to recognize. If you light them up sequentially, you can perceive movement of an object. The VPU captures and processes images and video from the camera in real time, so the scene in front of the Argus II patient is transmitted to the brain instantly, and over time, after an Argus II user learns to use the system and works with it in different environments, the person can recognize those signals as objects, people, and other visual items. Now here is another video that depicts in another way how the Argus II works.
In Second Sight's Argus II Retinal Prosthesis System, a miniature video camera in the eyeglasses captures the scene. The video is processed by a small portable unit and transformed into instructions which are sent back to the glasses. These instructions are then transmitted wirelessly to the implant on the eye. The implant consists of a receiver and an array of electrodes. Instructions are received and corresponding signals sent to the array, which emit small pulses of electricity. These pulses stimulate the retina's remaining cells and are transmitted down the optic nerve, conveying visual information to the brain, which perceives patterns of light. Patients learn to interpret these visual patterns.
Now let's talk a little bit about the outcomes of clinical trials. It is important to understand that outcomes were variable patient to patient. Everyone was able to see something, but the quality and usefulness of the vision varied. Although we still cannot predict with certainty who will respond well and who will not, we have a fairly good idea who will respond. In our experience thus far, the people who have adapted well to their blindness will typically adapt well to the Argus II. In functional vision assessments performed in the clinic, patients showed significant improvement in object detection and localization, identifying the direction of motion of an object, identifying large, high-contrast letters and words, and over 1/4 of the patients regained measurable visual acuity. In visual function assessments, in other words, how does the vision help in everyday life, patients showed improvement in orientation and mobility, such as finding doors and following lines, and activities of daily living, including sorting laundry, staying on a sidewalk, or identifying a moving person. In quality of life therapeutic impact assessment, we found that 77% of patients received a meaningful benefit from the system, and none had a negative impact. The next 5 slides show the types of testing that we used to evaluate improvement in functional vision of our Argus II trial subjects. Square localization involved randomly placing a white square on a computer touchscreen and asking subjects to touch the area where they saw the white square. This test showed that the Argus II system improved the ability to locate an object. Direction of motion involved a white line that moved from one side of a computer screen to another, and subjects were asked which direction they saw the line move. This test showed improvement on a spatial vision task. Character recognition involved placing a large letter on a computer screen and asking subjects to identify the letter. In this video, the subject can not only identify the character, but can also trace it with their finger and identify that the size of the character is changing.
Say an R.
Yes.
S.
Yes.
An O.
Yes.
A V.
Yes. Yes.
C.
Yes.
An O.
Yes.
Subjects were also asked to demonstrate improvement in orientation and mobility tasks. The first involved finding a door on a white wall. In this task, subjects were better at finding the door with the Argus II system on. The next task involved a subject following a white line that changed direction. In this task, subjects were better at following a line with the Argus II system on. In 2010, the FDA requested that we conduct a real-world assessment of our subjects, so we developed a test. In consultation with the FDA and low vision experts, called FLORA, F-L-O-R-A, which is an acronym for Functional Low Vision Observer Rated Assessment. FLORA was added to the study in 2010, and it was used to evaluate how subjects use the Argus II system in their lives, and what effect the Argus II system had on their quality of life. It was performed by trained, certified low vision therapists who used standard low vision assessment techniques, and 4 to 6 hours were committed to completing the FLORA with each subject. In a group of 26 subjects, 77% had a positive experience. Subjects performed significantly better on a sock sorting task, sorting light and dark colors, sidewalk tracking, and identifying the direction of someone walking. With regards to safety, the results of the clinical trial showed that the Argus II system had a very good safety summary. In the trial, there was no permanent impairment, no loss of residual native vision, and adverse events were resolved using standard treatment methods. The conclusion of the study with regard to safety was that the safety profile was acceptable, especially when considered in the context of profoundly blind subjects. In other words, we did not make any of our blind subjects more blind. The Argus II is a durable, robust, and upgradable device. It has been implanted in patients over 10 years, and most of the functionality comes from the software that runs the system. It is intended to work in conjunction with other assistive technologies, with each providing its own benefits, and as a package will provide a powerful, integrated system that is intended to enhance the lives of the blind all over the world. There are 5 steps in the therapy process. 1. Determine if you are eligible. 2. Determine if you have insurance coverage. 3. Surgery. 4. Programming of your device, and 5. Low vision rehabilitation. So who is eligible to receive the Argus II? The Argus II Retinal Prosthesis System is intended to provide electrical stimulation of the retina to induce visual perception in blind patients. It is indicated for use in patients with severe to profound retinitis pigmentosa who meet the following criteria. 1. Adults age 25 or older. 2. Bare light or no light perception in both eyes. 3. Previous history of useful form vision. 4. Patients must be aphakic or pseudophakic. In other words, patients cannot have their original lens. If the patient has their original lens prior to implant, the natural lens will be removed during the implant procedure. And 5. Patients who are willing and able to receive the recommended post-implant clinical follow-up, device programming, and visual rehabilitation. The Argus II implant is intended to be implanted in a single eye, typically the worst-seeing eye. If you think you are eligible, you can call Second Sight customer service at 855-756-3703. We will ask you questions to determine if you may be eligible, what we call verbally qualified. If verbally qualified, we will have one of our clinical coordinators call you for a more detailed questionnaire to see if you are a candidate. Once cleared by a clinical coordinator, we will refer you to one of our implanting centers for a complete and thorough evaluation. If the implanting center says you are eligible and you are interested in getting the device, you will complete a consent process agreeing to the surgery, and they will do a surgical workup prior to surgery, consisting mostly of imaging. The surgery itself should take 2 to 4 hours under general anesthesia. Some of our patients have characterized the surgery as easier than a root canal. You will likely be discharged the same day. There may be some mild discomfort immediately afterwards, typically addressed with aspirin or some other over-the-counter medication. The implant is completely within the body and should not be visible. You will come back for exams by the doctor 6 to 7 times in the first year and 1 to 2 times per year afterwards. After surgery, your system will be activated, but it needs to be custom programmed and you will be trained on how to use the system. It takes several sessions of 1 to 2 hours each, starting at week 1 at the hospital or clinic. You can use the system at home when programming and training is complete. Once programming is complete, learning how to use your new vision is important for a successful outcome. You will receive a rehabilitation toolkit to take home to help you practice. You will receive rehabilitation from trained experts, 10 to 15 one-hour sessions. And like any other rehabilitation process, the more effort you put in, the more you get in return. So what does all of this cost? While quite costly, the treatment in many cases will be covered by your insurance, including Medicare. Your out-of-pocket expense will depend on the specifics of your insurance plan. If you are determined to be eligible and wish to proceed, we have a reimbursement department who can help you with the insurance investigation to find out all of the financial details prior to getting the system. So what about the future? Second Sight is constantly working to improve the benefits that you receive from the device. The implant will remain the same, while upgrades will be made to the externals and the software, which means that those who have already received the device can still enjoy the benefits from future developments. Some of the planned improvements include a new VPU and eyewear for improved comfort, increased processing power, and better aesthetics. Upgraded camera technology and improved software and new image processing algorithms. Improved stimulation strategies and algorithms to improve perception, and integration of other assistive technologies to expand overall capabilities and the functionality of the Argus II. Second Sight Medical Products is the global leader in artificial vision with over 400 issued patents and 100 patents pending. We are the leaders in groundbreaking research with over 75 scientific publications, 6 clinical and post-approval studies, and demonstrated benefit over 10 years post-implant. Second Sight has received extensive media coverage in all major countries and U.S. media markets, and have also received numerous innovation awards, including the Edison Gold Award and the prestigious National Medal of Technology and Innovation from President Barack Obama. For any questions or to see if you are a candidate, please call Second Sight Customer Service at 855-756-3703 or visit us on the web at www.secondsight.com. Thanks for listening.